In this essay, I will argue the fact that abortion is harmful to women, both physically and mentally. Adoption is the better option for both mom and baby. Pro-choice argues that there are no long-term physical effects of abortion, and the number of abortions bears no physical impression on a woman's physical health. Research states that women with a history of one abortion face a 2.3 times higher risk of having cervical cancer compared to women with no history of abortion. Abortion increases the risk of placenta previa in later pregnancies, a life-threatening condition for both the mother and her wanted baby, by 7 to 15 folds. Abortion is significantly related to an increased risk of subsequent ectopic pregnancies. Ectopic pregnancies, in turn, are life-threatening and may result in reduced fertility. Approximately 10% of women undergoing elective abortion will suffer immediate complications, of which approximately one-fifth are considered life-threatening. A study of the medical records of 56,741 California Medicaid patients revealed that women who had abortions were 160% more likely than delivering women to be hospitalized for psychiatric treatment in the first 90 days following abortion. Rates of psychiatric treatment remain significantly higher for at least 4 years. While psychological reactions to abortion fall into many categories, some women experience all or some of the symptoms of post-traumatic stress disorder, PTSD. PTSD is a psychological dysfunction which results from a traumatic experience which overwhelms a person's normal defense mechanisms, resulting in intense fear, feelings of helplessness, or being trapped or loss of control. Women may experience abortion as a traumatic event for several reasons. Many are forced into an unwanted abortion by husbands, boyfriends, and parents or others. If the woman has repeatedly been a victim of domineering abuse, such an unwanted abortion may be perceived as the ultimate violation in a life characterized by abuse. Other women, no matter how strong the reasons they have for choosing abortion, may still see the termination of their pregnancy as the violent killing of their own child. The fear, anxiety, pain, and guilt associated with the abortion procedure are mixed into this perception of grotesque and violent death. Still, other women report that the pain of abortion inflicted upon them by a masked stranger invading their body feels identical to rape. There is also a high risk of suffering from a sexual dysfunction after an abortion. 30 to 50% of women who had abortions reported sexual dysfunctions of both short and long duration, beginning immediately after their abortions. These problems may include one or more of the following: loss of pleasure from intercourse, increased pain, an aversion to sex and or males in general, or the development of a promiscuous lifestyle. There is a link between breast cancer and abortion. It is now common medical knowledge that a full-term pregnancy, especially before the age of 32, acts as a protective mechanism against breast cancer. The suicide rate within 1 year after an abortion was 3 times higher than for all women, 7 times higher than for women carrying to term, and nearly twice as high as for women who suffered a miscarriage. Suicide attempts appear to be especially prevalent among post-abortion teenagers. Over 20 studies have linked abortion to increased rates of drug and alcohol use. Abortion is also linked with increased depression, violent behavior, and alcohol and drug abuse, replacement pregnancies, and reduced maternal bonding with children born after abortion. No matter what the physical and emotional scars left behind for the grieving mother, bottom line, abortion kills babies. When left alone to grow and thrive in the womb, a fetus, or blob of tissue, develops into a baby. When a mother chooses to abort her unborn child, she chooses death, and there is no hope or future in death. When a mother chooses adoption, she chooses life and a future for her unborn child. There are many couples unable to have a child of their own and would welcome a newborn baby with loving, open arms. There are 2 main adoption options for a birth mother: There is open adoption, where the birth mother can choose to be a part of her child's life through pictures and letters for the first 3 to 5 years of the baby's life. There is no direct contact with the child. A birth mother can also choose to have a closed adoption and not be a part of the first 3 to 5 years of her baby's life. In a closed adoption, the birth parents and the adoptee, once he or she reaches 19 years of age, can register with the Adoption Reunion Registry in Victoria, BC. Once this is done, a search is undertaken and contact is made unless a veto has been declared. In some cases, openness is a part of an adoption plan, and children often keep in contact with birth family members, foster families, and others who have played an important role prior to their adoption. In the case of local infant adoptions, the majority are open adoptions. If you choose to abort your unwanted baby, there is no chance of a reunion. Let's compare adoption to abortion. If you adopt, you will be free to pursue your goals and dreams that you had before you were pregnant. You will not have to care for a baby before you are ready. You will not have the financial burden of caring for a child. You will not have to worry about finding a sitter, missing out on fun with your friends, and being tied down. When you think of your baby, you will think of him or her as happy and loved by a mommy and daddy. You will know you gave the greatest gift of all, a child, to a couple whose dreams and hopes was to have a baby to love. If you abort, you will be free to pursue your goals and dreams that you had before you were pregnant. You will not have to care for a baby before you are ready. You will not have the financial burden of caring for a child. You will not have to worry about finding a sitter, missing out on the fun with your friends, and being tied down. There is no baby to think of, no smile, no little toes or fingers to remember. You have only the memory that you ended your baby's life. Instead of feeling good about how your pregnancy ended, you may feel sad and empty, but you can never go back and give life to your child. The abortion procedure itself is painful and not always guaranteed a success. In Canada, approximately 3% of reported abortions were done using pharmaceutical drugs. Medical abortion is considered successful if complete expulsion of the embryo and placenta occurs without the need for surgery to complete the abortion. Medical abortion is not commonly recommended in pregnancies past the first 49 to 63 days because of the increase in incomplete abortions, heavy and prolonged uterine bleeding, and ongoing pregnancy past this stage. When severe bleeding or pain is present, surgical techniques are used to complete the abortion. Medical abortion takes longer than surgical abortion, is less effective, and requires more clinic visits. Medical abortion results in heavier, more prolonged bleeding, and more pain, nausea, and vomiting than surgical abortion. Medical abortion has a 10-fold greater risk of serious infection and death than surgical abortion. With some of these abortion procedures, there is a chance that the abortion will fail and the baby will live. What happens then when the mother is faced with a child who may have deformities or brain damage, a direct result of the mother's selfish decision to abort? As I have stated in this argument essay, there are plenty of negative side effects for women when they choose abortion. The only positive outcome for the mom is that she is no longer pregnant. What if the woman is raped? You can't go very far in any discussion about abortion without considering the question of rape. No matter what the circumstances are regarding a child's conception, they are a human being with a right to life that cannot be taken away from them. Abortion is an act of violence that kills a living human being. Rape and abortion share this in common. They are both acts of violence against an innocent victim. Whereas rape is an act of violence for which the woman bears no responsibility, abortion is an act of violence for which she would be morally culpable. What if the mother is addicted to drugs? Do we deal with drug addiction by killing everyone who is addicted to drugs? It is essentially implying that a baby is better off dead than being born addicted to drugs. Drug addiction isn't the issue. Humanity is the issue. Abortion is legal, therefore it's okay. Slavery was legal 150 years ago. But that did not make it right. Just because something is legal does not make it right. There are all sorts of circumstances that people point to as justification for their support of abortion. Since none of these circumstances are sufficient to justify the killing of human beings after birth, they're not sufficient to justify the killing of human beings before birth. After writing all facts regarding abortion, I have concluded that women who choose abortion must simply be desperate to not be pregnant anymore. Women will choose ignorance regarding abortion just so they can go through with this procedure. It's very hard to believe a woman would knowingly commit to such violations of her body if they really knew the truth of abortion and its effects on their health. One woman explained her abortion as a violation similar to rape. Many women had feelings of, "What have I done?" immediately after the abortion was complete, only to severely regret their decision. Abortion is a final, no second chance at life decision. Adoption is, there is hope for the future of my baby decision. So why would a woman choose the shame of abortion rather than the life choice of adoption? Maybe the answer lies in this quote. "It's easy for me to kill you than to wave goodbye." Dr. Laura Schlesinger, speaking about those who choose abortion over adoption.